Hey everybody, it's Dr. John Burroughs at Springs Aesthetics. I'm with Peyton for the afternoon, and I'm going to talk about LidLift goggles. These are very important to your healing, and I find that patients who wear these the way we're going to instruct you to will heal 3 to 4 times faster. So I used to tell patients they might have a fair amount of bruising and swelling even up to a few weeks after surgery. Nowadays, if they wear them the way we instruct them to, most of the time at a week, they're going to look like they're 3 to 4 weeks out. They are amazing. So the way they work is the special foam lining is going to hold gentle first aid kind of pressure against the area of the surgery. So it decreases the chance of the capillaries leaking fluids, and it also decreases the chance of any rebleeding. Also, when you wear them at night, it's going to protect them from coming apart because your pillow or your hand isn't going to be able to disrupt the wound. So the way you're supposed to wear these is for the first 2 to 3 days, wear them almost continuously. So that means the only time you should be taking them off is for brief 10 to 15-minute breaks when you're eating, or if you need to get up to go to the restroom, or answer a phone call or something along those lines. But the more you wear them, the faster you're going to heal. Now, again, I say 2 to 3 days because most of the time 2 days is enough. But if we instruct you after your surgery because you might have bled just a bit more, we may instruct you to do 3 days. But irregardless, wear them at night for that first week while you're sleeping. Now, one thing to do if you're having a lot of discomfort over your bony rims or at the sides, you can cut out a little flap of the foam like it shows on this side, so that when they're up against your facial bones here, there's a little bit of gap of the foam so it's not pushing in that tender area. Not everybody has that tender area, so we suggest you just try and wear them at first, but I wanted to kind of show you the area to kind of notch out. Now, the other thing that's special sometimes is if you have sleep apnea and you have a mask that you need to wear at night, sometimes you may need to take out a little bit of the foam on the part around your nose, and that a lot of times will make it compatible while you're sleeping at night. Now, if you are wearing these and you're starting to feel claustrophobic, you can take them off for periods of time. And I suggest sometimes that patients practice a little bit in advance because they are opaque. You cannot see through these. And that's the way they work, is by holding that pressure over the entire area. You're going to make your healing faster and decrease the risks of rebleeding by wearing these the way we're instructing. Now I'm going to quickly demonstrate how to put them on. You want them to be a little bit snug, just like if you cut your arm and you had to hold pressure on it, you wouldn't just put it there, you would hold it down a little bit. But it shouldn't be very uncomfortable. It should just feel snug to the area. One thing that can be helpful is to keep it from sticking to either the mask or your goggle lining there, is to put a little Vaseline on the inside lining before you put it on, or right onto your eyelid where your stitches are. And then you can also put just a little bit on the eye patch lining that you're going to put over the eye. Go ahead and close. Now, the eye patches are only needed if when you take it off there's blood on them. Usually after a few hours after surgery, they're not weeping much, but we give you enough for probably 4 or 5 changes. And then you put that on, and if you would, come around and show, so you can see sometimes that's a tender area right over the brow, and that's why I notched it right there. But you don't want to take out large parts of it, or it's not going to really compress around the area. And then, like I mentioned, if it's closing off your nasal passage or you can't get your CPAP mask, some patients are able to take out a little bit right there, and that can help you wear your goggles and be compatible with that. Really, that's all there is to it. You don't want to share these between patients because of the body fluids that can get on it. But other than that, these are fantastic. And if you want to heal the fastest and the safest, I recommend you wear them.